Are you looking to enhance your MSK ultrasound skills? Today we are looking at the elbow, a common area of pathologies and injuries. Hi, my name is Jakub and today I will guide you through the basic examination protocol of the elbow. I will show you where to look for joint fluid and how to identify soft tissue structures around the elbow. We will examine the elbow from 4 different views: anterior, medial, lateral and posterior. The examination begins with the anterior view. In the transverse plane of the elbow, we can identify the hyperechoic line representing the distal humeral epiphysis covered by the hypoechoic articular cartilage. Key soft tissue structures are visible, including the pronator teres, brachialis and brachioradialis muscles. The scan also reveals distal tendon of the biceps, brachial artery and median nerve. When we look laterally, we can see the brachioradialis muscle and the radial nerve. Moving more proximally, we can observe the muscle belly of the biceps brachii. Medially, we can identify the pronator teres muscle. In the longitudinal plane, placing the ultrasound probe laterally allows us to view the radiohumeral joint. In this view, we can distinguish the radial head, capitulum of the humerus, and the radial fossa, which is an area to assess for joint effusion. A small amount of fluid in this space can be physiological. Moving the probe medially, we can visualize the humeral ulnar joint, specifically the trochlea and coronoid process. This view also highlights the proximal coronoid fossa, another common site for fluid accumulation. Additionally, we can assess the brachialis muscle. Next view is the medial view. With the elbow flexed at 90 degrees and the probe positioned on the medial epicondyle, we can visualize the common flexor tendon in the longitudinal axis. This view is particularly useful for assessing medial epicondyle tendinopathy or golfer's elbow. Next view is the lateral view. With the elbow flexed at 90 degrees and the probe positioned on the lateral epicondyle, we can visualize the common extensor tendon in the longitudinal axis. This view is particularly useful for assessing lateral epicondyle tendinopathy or tennis elbow. The last view is posterior view. With the probe positioned over the olecranon, we capture the triceps tendon in its long axis. This view reveals the triceps muscle, its myotendinous junction, and the tendon intrusion on the olecranon. Additionally, we can assess the posterior joint recess in the fossa olecrani, where a small amount of fluid may be present between the fat pad and the humerus, which is often normal in this area. So that was the basic ultrasound examination protocol of the elbow. I hope you found this tutorial helpful. If so, please like and subscribe for more tutorials. Thanks for watching and see you next time.